We will open the abdominal wall this time. So an incision passing through all layers of the abdomen at the paramedian plane was made. So you can see the cut anterior rectus sheath right there. You can see the rectus abdominis muscle. Again, the incision here was made along the paramedian plane or line, and not exactly at the midline. You can see the umbilicus right there. That's where the midline is, and you have the least number of layers at the midline, where the linea alba is found. So let us inspect first the exposed deep side of the anterior abdominal wall right here. So you can see the area where the linea semilunaris or semilunar line is found. You can see the lateral abdominal wall muscle right there, and we have this part which looks it looks like it's covered by a thick connective tissue, because that's where you have your posterior rectus sheath. The posterior rectus sheath again is formed by the aponeurosis of internal oblique muscle and transversus abdominis muscle. So the rectus sheath disappears below the arcuate line. And where is the arcuate line? It's okay, the arcuate line is somewhere at this level right here. Try to inspect this area closely and try to compare with this area up here. Now, down here, you can see through the semi-translucent. You can see through the semi-translucent layers of the abdominal wall. The innermost layer of that, of course, the innermost layer that we can touch right here, that's the parietal peritoneum. Next layer outside that is the extraperitoneal fascia. In some instances, it's infiltrated by fat. We can also refer to that as the layer of extraperitoneal fat, but not in this case. It does not look really fatty in this case. So this area, the posterior rectus sheath, is missing. You can somehow see the vertically position of fibers of the rectus abdominis muscle, which is not clearly visible, not as clear as you can see the fibers here. So the posterior rectus sheath, which is quite thick, is obscuring the fibers at this level. So the arcuate line is somewhere in along that area. So these defects are actually injuries. Remember, our cadaver is a the cadaver has gunshot wounds on the posterior chest, and also here in the anterior abdominal wall. So let me direct you to the lower aspect of the anterior abdomen. You can see we have a thick ligamentous fold here. That is actually the medial umbilical fold or medial umbilical ligament. Medial, so it ends with letter L. So in the fetal anatomy, the medial umbilical fold or ligament actually contains the umbilical arteries, which arise from anterior division of the internal iliac